one of our goals is to connect with our community, with the corporate community, with businesses and local organizations, to give them an opportunity to find out about the breadth and the depth of the programming that takes place here, and more importantly, to learn about the clients who are receiving that care and that treatment. One of the outcomes that I've seen in regards to facilitating the corporate volunteer program is it gives an opportunity for local companies and agencies to come and find out about the programming. Here at camh, through the corporate volunteer program, we're trying to create partnerships to build and to sustain healthy communities. The Canadian Institute of Chartered Accountants actually had a firm grasp and understanding of the importance of being connected with our community here at camh and understanding the impacts of stigma and the stereotyping of individuals who live with or experience mental illness and or addiction. I had the unique opportunity to help facilitate and coordinate a gardening day that took place with the Integrated Rehabilitation Unit, which is a unit that provides support and treatment for people who are experiencing schizophrenia. They connected with the clients and the staff, they planted, they put down the mulch and the soil, and they really had an opportunity to connect with the clients and to see the individual first and not the illness. And that's one thing. At the Center for Addiction and Mental Health, camh, we provide support and treatment for people who are living with or experiencing severe and persistent mental illness and or addiction. Our clients are provided an array or constellation of services that we provide here. We like to promote a client-centered care approach where the individuals who are coming to receive treatment or support can have input in terms of what their recovery is going to look like. That goes a long way in regards to minimizing the stigma or the stereotypes associated with individuals who are experiencing illness or addiction. We have clients who come in who receive support for schizophrenia, mood and anxiety, depression, children and youth services. The services are many, and camh provides a continuum of support for those individuals who are in need of treatment and care. Here at camh, in particular at this site, at the Queen Street site, this particular site was referred to as the Ontario Provincial Lunatic Asylum back in the 1850s. The name was then changed to the Toronto Lunatic Asylum, and in the 70s it became the Queen Street Mental Health Center, and some individuals may remember it when it was referred to as 999 Queen Street. So in regards to just the labeling that has taken place here, we've come a long way in regards to the transformation of care and treatment that is provided for our clients. And the labeling is another example of the stigma that is put forth against the clients who are here to receive treatment and support. So if we go back to 1850 or 1859 rather, when the Queen Street site, currently where we're here today, opened up, we've come a long way in regards to helping debunk and demystify illness and addiction. We are currently undertaking a massive redevelopment where we're creating alternative milieu settings where our clients can come into a place of care and support where they again are aligning their treatment with the therapists or with the clinicians they're working with, and they're focusing on their self-care. The treatment is becoming less institutional and it's becoming more individualized. So I personally think that's a wonderful thing in regards to providing the support for people and helping people nurture that care and their recovery, and helping individuals lead a meaningful and genuine life where they can be integrated back into the community, where they're part of the community, and they can continue to live lives to their fullest. camh, and here with the corporate volunteer program, it's providing an opportunity for companies and businesses to come to learn about the programming here at camh. And again, to learn about the individual and not the illness, and the importance of focusing on the person. And really, through the interactions in the corporate volunteer program, when the employers are coming and having the opportunity to visit, to meet, and to just engage, they can see the individual, and they can see the strengths, talents, and abilities who sometimes, as a result of their illness, that their skills and strengths and talents may have diminished. And it's really wonderful to see when they're engaging the corporate volunteers that those skills and strengths and the confidence and the self-esteem is really impacted through the engagements of the employees who are coming to reach out and to try and understand what our clients are facing in regards to the challenges of illness and addiction. So one of the other outcomes that I'm really extremely happy about is that when companies come, I think it also gives them an understanding of illness and addiction, and we have an opportunity to bring addiction and illness out of the shadows, out of the darkness. And I think it also provides an opportunity for people to start to normalize and universalize what illness and addiction is. And perhaps as a result of their experience here with the corporate volunteer program and having meaningful relations and creating bonds with our clients and our staff, that they themselves will go back out into their community, not only the corporate community, but also their communities where they live and with their families, and start to feel comfortable about sharing some of the challenges that they may face. The Health Canada states that there's 1 in 5 Canadians who are impacted by mental illness and or addiction. I personally feel that we're all impacted on some level, and the importance of the employees who come from the different companies and have an opportunity to see the diverse programming that takes place here, and to see the wonderful talents and abilities that our clients have. I think they walk away with, if they had any perceptions, I think they walk away feeling that our clients are just like the rest of the community, and they're no different, except for they're struggling with an illness and they're living with an addiction. So not only are the employees who come have that opportunity to learn about people, but I think the important piece is actually sharing that message. So coming away with a meaningful experience here through the corporate volunteer program at camh, and then sharing those profound experiences that I've seen and I've observed, and taking that back to share with their colleagues, to share with their friends and family, and to send out the message about illness and addiction, that people are no different, and sharing about some of the programs that they may have learned about as a result of their experience here. But the important piece is about the universalizing or the normalizing, and bringing the mental illness and shedding light on the stigma. And the corporate groups and the employee volunteers who come through really become ambassadors in regards to sharing that message with their community. And this is one of the wonderful outcomes, I think, in regards to them embracing our community here at camh, where they had the ability to focus on the person and not the pathology, and through their interactions and their friendly visiting and the structure of the gardening day, that they had an understanding of the importance of engaging our clients who, again, through the stigma associated with illness and addiction, our clients are isolated or marginalized. This was a company who wanted to reach out to the community to find out about the work that's done here and to find out about the diverse programming, and in particular the programming that takes place at IRU. And I commend the employees at the Canadian Institute of Chartered Accountants for not only reaching out to the camh community, but embracing the culture here and really being pioneers for the corporate volunteer program here at CamH, and I thank them all.